why don't you go ahead and start by explaining what exactly corneal disease is?
Sure. I guess the way I like to explain it is first to cover what is the cornea. It's a very thin, clear piece of tissue that covers the front part of the eye, and it's almost like a looking glass or a window into the eye. It protects the eye and also focuses light to help vision. Corneal disease can be a result from a variety of different things. It can be hereditary, it can be due to trauma or surgical injury, or it can be due to infection. And so there's a lot of things that we study and that we carefully look for when we're talking about corneal disease.
Now, you mentioned that it's genetic, and you mentioned that it could be caused by a trauma to the eye.
Yep.
But does it only affect people of a certain age, or can young people also get corneal disease?
It's a great question. Actually, traumatic corneal injury is one of the most common forms of injury in children. I've done quite a few surgeries on kids that, you know, for whatever reason were you know, throwing a pencil at each other or something like that, and it's something that is actually quite common. Another age group that is often affected are, as far as trauma, are construction workers and people, you know, mechanics and people that do a lot of metal grinding, work with a lot of, you know, heavy equipment and don't wear eye protection. And so that's something that I did want to stress, is that eye protection is very important.
I would imagine also athletes, such as pro athletes or people that are involved in Little League, where they're throwing things that are projectile, could,
Yep.
Could possibly be candidates for that.
Definitely.
Now,